first, I would like to ask you permission to use this video for educational purpose and on internet.
Yes, you may.
Now, you had a very good question, and I'm sure many of my patients have the same question.
Yes,
Tell me.
Does Alendronate keep me from healing quickly on my bone?
That is such a nuanced question and very good question. Now, to put it in perspective, you got a quite significant surgery in the neck, but my last surgery was 6 months ago here in the C7T1. And let first me ask you, why are you taking Alendronate? Why are you taking that? Osteoporosis?
The doctor told me to.
Yeah.
Because of the
Soft bone.
Yes, soft bone,
osteoporosis.
yes.
Believe it or not, the way we discovered Alendronate is from washing machine detergent. Because what they do, they sort of prevent the calcium to be solvable in fluid. They make the calcium stay where it should be. And if you have osteoporosis, we want the calcium to stay in your bone, right?
Yes.
And that is why Alendronate is a good medication to keep the calcium in the bone. But unfortunately as well, it prevents the bone to be put, the calcium to be put in the bone. So it keeps the calcium where it is. If it's calcium is inside of the bone, stays there. If calcium is not inside of the bone, it won't go inside of the bone. It just keeps the calcium where it is. Now, right after the surgery, we want your cells to go inside of the bone and put calcium in. Alendronate is good medication for osteoporosis because it prevents the calcium to be taken out by making it less available, less solvable. But on the other side as well, we know that it prevents the bone to be put in. So it just prevents the calcium moving around.
Okay.
So do you understand what that means?
Well, kind of, but is there something I could be taking better that would aid in this
Yes,
healing?
yes. See, there are medications like hormones that are specifically take the calcium and put it in the bone.
That's what I want.
Yes. So, and there are like, Forteo is one of those medications. Is a hormone of our parathyroid that make specifically take the calcium and put it in places. Now, Alendronate by itself is a great medication for lots of situations, but right in the time around the surgery when we do spine surgery or bone surgery, not only it prevent the bone to be taken out, but as well it prevent the bone to calcium to be put back in the bone. So that has sometimes that effect that it's not my favorite medication after spine surgery. But other medication like Forteo or hormones that move the calcium in one direction from our blood into our bone, they're much more preferred.
Okay, well, do I take what you're suggesting along with this or quit the Alendronate for a
And
while?
that is a very good question for a hormone doctor or endocrinologist, because they don't only work on your bone, they work on lots of different systems. Like, imagine we give you a medication that makes the bone grow harder and harder. But as well, sometimes bone can grow in places it shouldn't be growing. So that is a question for somebody who is an expert there. Okay? So long story short, your Alendronate is that, yes, it helps your osteoporosis, but as well it slows down bone healing after the surgery. Whereas some other medications that are more aggressive, which have to be used in a very coordinated way, because otherwise they can as well build bone in places there shouldn't be no bone. So talk to your family doctor, talk to endocrinologist, and using other medication might be a better option right after the surgery. Does that answer the question now? Thank you very much.